My treatment plan consisted of a lumpectomy followed by chemotherapy followed by radiation. I know typically people have the lumpectomy or the mastectomy after the chemo. Mine was a little bit different, and that's because when I initially went to get my biopsy after I was diagnosed with breast cancer, nope, that's not correct. I'm sorry. When I had my first biopsy, so they knew that I had something was going on, and I had the biopsy. They did the biopsy in the underarm area on the sentinel lymph node. It came back clear. There was no cancer in there. And then when I had a PET scan, it showed up as cancer being in my underarm area. So I ended up having another biopsy, which came back clear. So the doctors weren't sure what exactly was going on. They decided to go ahead and do the lumpectomy first, thinking that my treatment plan was going to be a lumpectomy followed by radiotherapy. What ended up happening was during that first lumpectomy that I had, there was indeed cancer in my sentinel lymph node. And they said that my surgeon told me that the lymph node was almost bursting. She said it was huge. So I don't know if my cancer was just very fast moving or what exactly was going on, why the biopsies did not pick up on it, but they didn't. I ended up having a second lumpectomy because the margins weren't clear on my first. After my second lumpectomy, I had my first round of chemotherapy about 3.5 weeks later. So I'm thinking that it's probably a similar treatment plan time-wise with radiotherapy. After I finished my chemotherapy, we waited a month and then we started the radiotherapy. So in a nutshell, I waited about 3.5 weeks from the time I had surgery to the time I had chemo. So perhaps that's the same for radiotherapy.